I'm Kurt Keller. I have been with Health East for 5 years and work in Health East medical care for seniors. And we go to nursing homes and transitional care units, and most of my work is taking care of the transitional care units. These are people who are still pretty sick. They've come out of the hospital and they've got a lot of medical needs. They could be a hip replacement, they could be a bone marrow transplant, or anything in between. And they don't stay in the hospital a long time, so we're doing the subacute work. And a lot of these people are, it's questionable whether they're going to be able to get good enough to go home, so rehab is a major focus. And if they can get their strength and stability, and I can take care of all their medical needs along the way, they may get good enough to go home. Some of them really aren't able to go back to independent living. They may go to an assisted living setting, or they may wind up in long-term care. But every effort is made to get these folks back on their feet and home if at all possible. Well, for me, one of the attractions was it was a bit of a step down from the routine I had when I was in practice. The weekend call is taken by our nurse practitioners. I do everything I can to get all the problems solved, so somebody isn't calling them about a patient they don't know. But I have backup calls, so the nurse practitioners call me when there's something. But it's not like the old days when the call came and I might have to go to the hospital and take care of them. So it's a nicer pace from that perspective. It's a nice pace because I can take care of these folks, and I show up and I see them on my schedule, and nobody's badgering me about your next appointment's waiting, and we can work around that. There's a lot to do, but it's very rewarding to take care of patients and families and solve problems. There's a teaching element too. The TCUs, especially the nursing homes, hire a lot of new young nursing people who are they're learning, and we're only as good as our whole team, whether we're there or any place else. And if I can help these people know what we need to look for, what we're doing, why we're doing it, I think we empower them to do a better job. There's an awfully lot of interaction with families. I like that because elderly people, some of them are very sharp, some of them are having trouble remembering their history, and certainly the families are concerned about them and wanting to know what's going on. So often they're there in person, and often we call them, but it may seem cumbersome, but it's really medicine for these people, as it should be. Most of my patients are in their 70s, 80s, 90s, and families are involved. It's rewarding. It takes some effort, but when I can walk in, solve problems for the nurses and the patient and the family, and people are glad to see me come, it makes me want to keep coming.